My name is Nick Sharp, and in this presentation we are going to take a look at ulnar collateral ligament tears. As an overview, the ulnar collateral ligament is a strong band of tissue that resists valgus stresses, and it has three bands. They are the anterior band, the posterior band, and the oblique band. The anterior band being arguably the most important. The UCL is most often injured due to repetitive overhead or throwing mechanics, and sports in which this can occur includes baseball, swimming, softball, football, track, as well as other sports. Tears can occur gradually or in a single traumatic event, or a little bit of both. As far as anatomy goes, the bony anatomy includes the humerus, the ulna, the radius, and the olecranon process of the elbow. The ligamentous anatomy includes the ulnar collateral ligament, which is what we will examine in this presentation, as well as the radial collateral ligament. And the nervous anatomy includes the ulnar nerve. Types of UCL injuries. The ulnar collateral ligament can be stretched, frayed, or torn. With stretching, the throwing motion can result in micro tears, gradually causing ligamentous rupture, and a tear can be partial or complete. And how we classify that is by grades 1, 2, and 3, with grade 1 being the ligament is stretched with no tear, grade 2 the ligament is stretched with a potential partial tear, and grade 3 the ligament is completely torn. Chronic UCL injuries are much more common than acute UCL injuries. Signs and symptoms include a popping sound, pain on the inside of the elbow like a sharp shooting pain, which can result in the inability to throw or perform certain movements, especially against resistance. Pain with arm acceleration, which is phase 4 of the throwing mechanism. Numbness and tingling in the fingers, especially the pinky and ring fingers. Ecchymosis patterns around the elbow. And it is unlikely to affect non-sport related activities such as carrying items like groceries. Predisposing factors include throwers and pitchers. They are much more common in those that are under the age of 15 due to repeated stress. Throwing specialty pitches in baseball or softball, such as like a curveball, it puts more stress on their elbow, which is not fully developed. And these conditions such as tennis elbow, cubital tunnel, and arthritis can also predispose an athlete to ulnar collateral ligament tears. The mechanism of injury, chronic-wise, includes gradual stretching of the ulnar collateral ligament, tissue degradation from repetitive significant forces and blows, and acute mechanism of injuries include elbow dislocations, fooshing, a pop or tear during the throwing motion and release, such as during arm acceleration or deceleration. Pathology includes intense pain versus dull pain, which intense pain is indicative of an acute injury versus dull pain will typically be indicative of a chronic injury. There's decreased range of motion as well as increased edema and ecchymosis patterns. Special tests include the valgus stress test, which we already learned, a moving valgus stress test, which is just testing through a range of motion, as well as the valgus extension overload test, which is where the elbow is placed in 20 degrees of flexion, the arm is abducted to the side at 45 degrees, and a valgus stress is applied with gradual range of motion while moving into extension. One hand supports the wrist around the distal ends of the radius and the ulna, and the other hand supports the elbow with the fingers wrapping around the medial portion of the elbow. Positive findings include joint laxity and pain, especially when moving into extension with the valgus stress applied. Joint mobilizations, there are many things that you can do with the joint mobilization of the elbow. Flexion and extension glides, as well as if the patient is lying supine, one hand will go around the distal ends of the radius and ulna, and the other hand will support the inside of the elbow. Prone, one hand will support the distal ends of the radius and ulna, and the other hand will be on top of the olecranon process. Mulligan technique, a lot can also be done with this. You need to find a good position for the athlete or the patient. You can do flexion extension, internal external rotation, and typically, as always, follow the 2 sets of 10 reps rule. Prevention includes training proper biomechanics, proper stretching, functional progression and warm-up throwing stages, as well as increasing muscular strength in the surrounding arm muscles, which include the triceps brachii, the biceps brachii, the coracobrachialis, the pronator teres, the palmaris longus, and any and all extensor and flexor muscles of the forearm. Referral management, a MRI scan can be done, and any indication of or imaging of a tear should result in immediate referral to a physician or a elbow specialist. Treatment includes rest, compression, non-steroidal, anti-inflammatory drugs, surgery, and there are different kinds of surgery. There's repairment, which is an acute singular injury or a result of an acute singular injury, and the ligament is mostly intact but has torn off the bone. A replacement or reconstruction is typically what is more common. It is a result of chronic multiple injuries, as well as an acute injury, such as if a pitcher throws a pitch and feels a complete tear of their UCL on the medial side. Tommy John procedure is done for this, and there are 2 different kinds of tissue harvesting. There's autograft, which is where the tissue is harvested from another area of the body on the individual that is receiving Tommy John, and an allograft, which is tissues that come from a human donor tissue bank. Tommy John surgery is where tendons from other body locations are harvested to reconstruct the ulnar collateral ligament. Typically, most common, you will find them harvest from the hamstrings, but they can also be harvested from the palmaris longus tendon and the extensor hallucis longus tendon. On average, it takes roughly a year to recover from this procedure and return to full strength and functional ability, but depending on the athlete and their diligence in their rehabilitation program, it could be less than a year or it could be greater than a year. Immobilization includes slings, spicas, and braces. Differential diagnosis includes Little League elbow, which is an overuse injury that's common in young pitchers. Tennis elbow, which is inflammation and tenderness around the lateral epicondyle of the elbow. Cubital tunnel, which is ulnar nerve impingement within the cubital fossa. And arthritis, which is general decay of joints and ligaments. Here's my background for my PICOT analysis, as well as the methods. Results. And the conclusion. As far as the PICOT analysis itself, the population included 273 baseball players that had undergone a UCL reconstruction procedure. The intervention was a valgus stress radiograph protocol, used a TLOS stress device to provide stress in a standardized fashion. Comparison was 76 individuals with a complete tear versus 150 individuals with a partial or incomplete tear of the ulnar collateral ligament. The outcome was the thrower's elbow with a UCL injury opened 0.4 millimeters more than the uninjured side, and those with complete tears opened 0.6 millimeters on average, which was significantly more than those with partial tears, which opened on an average of 0.1 millimeters. And there was no timetable for this analysis. Here's my PICOT reference, as well as my works cited.